In this video, we will explore the top 25 interview questions and answers specifically tailored for NHS housekeeping positions. These insights aim to help candidates prepare effectively and increase their chances of success in the interview process. Understanding common questions can provide clarity and confidence during interviews. We will break down each question, offering sample responses that highlight essential skills and experience relevant to NHS housekeeping roles. 1. Why are you interested in working as a housekeeper for the NHS? I am interested in working as a housekeeper for the NHS because I believe in the importance of maintaining a clean and safe environment for patients and staff. My previous experiences have instilled in me a strong sense of responsibility towards hygiene and patient care. Working within the NHS aligns with my values of contributing positively to the community and supporting healthcare professionals. I take pride in my work and understand that cleanliness directly impacts patient recovery and satisfaction, making this role not just a job, but a meaningful contribution to society. 2. What do you know about our NHS Trust Hospital? The NHS Trust I am applying to has a strong reputation for providing high-quality patient care and maintaining rigorous hygiene standards. It is known for its commitment to innovation in healthcare practices and community engagement. The hospital prioritizes patient safety and has a dedicated team focused on cleanliness and infection control. Additionally, I appreciate the collaborative environment where staff members work together to support both patients and each other, fostering a culture of respect and professionalism. I am excited about the opportunity to contribute to such a reputable institution. 3. What qualities do you possess that make you well suited for this role? I possess a strong attention to detail, ensuring that every cleaning task is completed to the highest standard. My reliability and punctuality mean that I can be counted on to fulfill my responsibilities consistently. I am also adaptable, able to respond effectively to the dynamic needs of a healthcare environment. Empathy and compassion guide my interactions with patients and staff, fostering a positive atmosphere. Lastly, my ability to work collaboratively with others enhances team cohesion, which is essential for maintaining a safe and clean environment in the NHS. 4. How would you describe your attention to detail? My attention to detail is one of my strongest attributes. I believe that every corner and surface must be thoroughly cleaned to maintain a safe and healthy environment. I take the time to inspect areas after cleaning to ensure nothing is overlooked. For example, I check high-touch surfaces, corners, and behind furniture, as these areas can harbor germs and dirt. I understand that in a healthcare setting, a meticulous approach is crucial to preventing infections and ensuring patient safety. Consistency in my work allows me to uphold the high standards expected in the NHS. 5. Are you comfortable working in a healthcare environment? Yes, I am comfortable working in a healthcare environment. I understand the importance of maintaining cleanliness and hygiene in such settings, as it directly impacts patients' health and safety. I am aware that the atmosphere can be sensitive, and I am prepared to interact respectfully with patients, visitors, and staff. My experience in similar environments has trained me to be mindful of patient confidentiality and the emotional state of those around me. I am committed to adhering to the highest standards of cleanliness, ensuring that I contribute positively to the healthcare team and the well-being of patients. 6. What cleaning products and equipment are you familiar with? I am familiar with a wide range of cleaning products and equipment used in healthcare settings. This includes disinfectants specifically designed for clinical environments, such as bleach-based solutions and alcohol wipes, which effectively kill pathogens. I also know how to use multi-surface cleaners for various non-clinical areas, ensuring all surfaces are sanitized. Additionally, I am skilled in handling equipment like vacuum cleaners with HEPA filters, steam cleaners, and mops designed for infection control. My training ensures I can select the right tools for each task while adhering to safety guidelines. 7. How do you ensure proper infection control when cleaning? Ensuring proper infection control when cleaning involves several key practices. First, I always follow established protocols and guidelines specific to the healthcare environment. I use appropriate personal protective equipment, PPE, to protect myself and prevent cross-contamination. I pay attention to high-touch surfaces and ensure they are disinfected regularly with approved cleaning agents. Additionally, I maintain a clean and organized workspace, which minimizes the risk of spreading pathogens. Continuous training and staying updated on best practices also play a vital role in enhancing infection control measures. 8. What steps do you take to clean and disinfect a patient room? When cleaning and disinfecting a patient room, I start by gathering all necessary cleaning supplies and personal protective equipment, PPE. I then remove any waste and soiled linens, ensuring proper disposal methods are followed. Next, I focus on high-touch areas such as doorknobs, light switches, and bedrails, using appropriate disinfectants to ensure thorough sanitation. I clean surfaces from the least contaminated areas to the most contaminated, and I always follow the manufacturer's instructions for contact time. Finally, I conduct a visual inspection to ensure no areas are missed, maintaining a safe environment for patients and staff. 9. How would you handle cleaning an isolation room? Cleaning an isolation room requires strict adherence to protocols to prevent cross-contamination. First, I would don appropriate personal protective equipment, PPE, such as gloves, masks, and gowns. I would start by removing any disposable items and cleaning surfaces from the least contaminated to the most contaminated. High-touch areas, such as door handles and light switches, would receive extra attention. After cleaning, I would ensure all waste is disposed of properly and follow the specific guidelines for disinfecting all surfaces with approved cleaning agents. Finally, I would wash my hands thoroughly and properly dispose of my PPE. 10. What precautions do you take when handling hazardous materials or waste? When handling hazardous materials or waste, I prioritize safety by wearing appropriate personal protective equipment, PPE, such as gloves, masks, and goggles. I ensure that I am trained in proper handling procedures and follow the facility's protocols for disposal. I always label hazardous materials clearly and store them in designated areas to prevent accidental exposure. Additionally, I am aware of the importance of reporting spills or incidents immediately and maintaining a clean workspace to minimize risks associated with contamination or exposure. 11. How do you prioritize cleaning tasks during a busy shift? In a busy shift, I prioritize cleaning tasks by assessing the immediate needs of the environment and the patients. First, I focus on high-traffic areas and patient rooms that require urgent attention. I use a checklist to ensure that essential tasks, such as sanitizing surfaces and restrooms, are completed promptly. Communication with team members is crucial, as it helps me understand any specific requests or concerns. By managing my time efficiently and remaining adaptable, I can ensure that critical cleaning duties are addressed without compromising the overall cleanliness and safety of the facility. 12. What would you do if you noticed a safety hazard while cleaning? If I noticed a safety hazard while cleaning, my immediate action would be to secure the area to prevent anyone from getting hurt. I would then report the hazard to my supervisor or the appropriate personnel to ensure it is addressed promptly. Depending on the nature of the hazard, I might take temporary measures, like placing a warning sign, until it can be fixed. Safety is a top priority in a healthcare environment, and it's vital to act swiftly and responsibly to maintain a safe atmosphere for both patients and staff. 13. How would you handle a situation where a patient or visitor asks you to do something outside your role? In such situations, I would politely explain my responsibilities and the scope of my role as a housekeeper. I would reassure the patient or visitor that their request is important, but it falls outside of my duties. If appropriate, I would guide them to the right person, such as a nurse or doctor, who can assist with their request. Clear communication is key, and I would ensure they feel heard and supported while adhering to the protocols of my position. Keeping a professional demeanor is essential in maintaining trust and respect in a healthcare environment. 14. What would you do if you noticed cleaning supplies were running low? If I noticed cleaning supplies were running low, I would immediately inform my supervisor or the designated staff member responsible for inventory management. I believe in proactive communication to ensure that our cleaning standards are maintained without interruption. Additionally, I would check if there were any alternative supplies available in the storeroom that could be used temporarily. Keeping an organized list of essential supplies and regularly monitoring stock levels can also help prevent shortages, ensuring that we can always maintain a clean and safe environment for patients and staff. 15. How would you manage your workload if short-staffed? When short-staffed, I would first assess the cleaning priorities based on critical areas that require immediate attention, such as patient rooms and high-traffic zones. Effective communication with team members is vital. I would discuss workloads and delegate tasks based on each person's strengths. I would focus on maintaining quality over quantity, ensuring essential cleaning protocols are upheld. If necessary, I would also be prepared to adapt my work methods, utilizing time management techniques to maximize efficiency while continuing to provide a safe and clean environment for patients and staff. 16. Describe how you would interact with patients while cleaning their rooms. When interacting with patients while cleaning their rooms, I would maintain a friendly and respectful demeanor. I would greet them warmly, introduce myself, and explain that I am there to clean their space while ensuring their comfort and privacy. It's essential to listen to their needs or concerns and address them promptly. I would work efficiently but quietly, allowing them to rest without feeling disturbed. If patients have questions or require assistance, I would be ready to help while always prioritizing their well-being and maintaining a clean environment. 17. Tell me about a time you had to work under pressure. How did you handle it? Working as a housekeeper during a particularly busy shift, there was a sudden influx of patients in the emergency department. The cleaning schedule was disrupted, and rooms needed immediate attention. I prioritized by focusing on high-traffic areas first, ensuring patient rooms were cleaned swiftly while maintaining hygiene standards. I communicated with nursing staff to understand urgent needs and collaborated with colleagues to share the workload. This teamwork allowed us to maintain a clean environment despite the pressure, ensuring patient safety and comfort. Keeping a calm demeanor helped me manage my tasks effectively. 18. Describe a situation where you had to deal with a difficult coworker. Dealing with a difficult coworker can be challenging, but I approached the situation with empathy and open communication. In a previous role, a coworker was consistently dismissive of others' input, which affected team morale. I requested a private conversation, where I expressed my feelings about our interactions and encouraged them to share their perspective. This open dialogue helped us understand each other better and identify common goals. We agreed on a plan to collaborate more effectively, which improved our working relationship and fostered a more positive team environment. 19. Give an example of when you went above and beyond in your cleaning duties. When I worked at a local hospital, there was an instance during flu season when several staff members were absent. The cleaning team was short-staffed, and the hospital was more crowded than usual. Noticing that some common areas were not receiving the attention they needed, I took the initiative to clean and disinfect those areas during my breaks. I also organized a quick team meeting to strategize and prioritize our tasks, ensuring that patient rooms and high-traffic areas were addressed promptly. The effort led to a visibly cleaner environment, and my colleagues appreciated the teamwork. 20. How do you stay motivated when performing repetitive tasks? Staying motivated during repetitive tasks requires a few strategies. First, I focus on the positive impact my work has on patients and the healthcare environment. Knowing that a clean space contributes to their well-being is essential. I set small goals for myself, such as completing certain areas within a time frame, which keeps me engaged. Listening to music or podcasts while working can provide a pleasant distraction. Additionally, I remind myself of the importance of maintaining high standards, which fuels my commitment and helps me stay diligent in my duties. 21. Tell me about a time you received constructive criticism. How did you respond? Receiving constructive criticism is an essential part of personal and professional growth. Once, during a performance review, my supervisor pointed out that I needed to improve my time management skills, especially during busy shifts. I appreciated the feedback and took it to heart. I began using a planner to prioritize tasks more effectively, breaking down my responsibilities into manageable segments. This not only improved my efficiency but also allowed me to provide better service. I thanked my supervisor for their guidance and committed to continuous improvement in this area. 22. How familiar are you with NHS cleanliness standards? I have a strong understanding of NHS cleanliness standards, which emphasize the importance of maintaining a clean, safe environment for patients and staff. These standards include regular cleaning schedules, proper use of disinfectants, and adherence to infection control protocols. I am familiar with the specific guidelines set forth by the NHS, including the importance of reducing hospital-acquired infections through effective cleaning practices. I am committed to following these standards meticulously and staying updated with any changes to ensure compliance and promote patient safety. 23. What do you understand about patient confidentiality in a hospital setting? Patient confidentiality is a critical aspect of healthcare that ensures sensitive information about patients remains private and secure. It involves safeguarding personal health information, including medical history, treatment details, and personal identifiers. Staff must be aware of their responsibility to protect this information, sharing it only with authorized personnel involved in the patient's care. This confidentiality fosters trust between patients and healthcare providers, encouraging patients to disclose necessary information for their treatment. Adhering to legal regulations, such as GDPR and HIPAA, is essential for maintaining these standards in a hospital environment. 24. How would you contribute to maintaining high standards of hygiene in the NHS? I would contribute to maintaining high standards of hygiene in the NHS by following established protocols and guidelines meticulously. Regular training and staying updated on best practices would enhance my effectiveness. I would ensure thorough cleaning of all areas, paying close attention to high-touch surfaces. Open communication with the healthcare team is vital. I would report any issues promptly for quick resolution. Additionally, I would promote a culture of cleanliness, encouraging colleagues and patients to prioritize hygiene, ultimately supporting the well-being of everyone in the facility. 25. What do you think is the most important aspect of housekeeping in a healthcare environment? In a healthcare environment, the most important aspect of housekeeping is ensuring a clean and safe space for patients, staff, and visitors. This includes maintaining high standards of hygiene to prevent infections and ensure patient safety. Effective cleaning practices, such as using appropriate disinfectants and following proper protocols, play a critical role in controlling the spread of pathogens. Additionally, housekeeping staff must be attentive to detail, as even minor oversights can have serious consequences in a healthcare setting. It's essential to foster a collaborative relationship with medical personnel to support optimal patient care. In this video, we've explored the top 25 NHS housekeeping interview questions and their corresponding answers to help you prepare effectively. Understanding these questions can significantly boost your confidence and performance during the interview process. We hope you found this information valuable and that it aids you in securing your desired position within the NHS. If you enjoyed the content, please give us a thumbs up and don't forget to subscribe for more helpful insights and tips. Your support means a lot to us, and it helps us create more valuable content for you. Thank you for watching.